Welcome everyone to Movement Matters with three clinicians and a mic, where we come to you with 3 degrees of perspective on physical therapy. I'm Jessie, the doctor of physical therapy.
I'm Christiane, the PTA.
And I'm Veronica, the PTA.
Yay! So today we have a very important topic because we believe that movement needs to start really young, as hopefully you saw last week's podcast. So if you haven't, go back and watch it because it's a good one. But let's move on to more like the younger athletes, when they could start, and more importantly, how we could pre-screen to make sure that they are ready to do those athletic trainings, whether it's little league things or sports and organized sports and all that.
And I want to add to that even if you're not thinking about your child going to sports at an early age, think about overall just safety, right? Oftentimes where the pre-screening gets lost in translation, and how many children, my older daughter had a situation when a little kid, he was like 4 or 5, had a heart condition that nobody knew, and playing on the playground, he ended up, passing away. So those things, like, we really should touch all of that, because I don't want people to click off and be like, oh, I don't have an athlete kid, so this doesn't apply to me.
Right.
Which is really not the case. It could be any kid. You want to play tumbling with your kid, headstands and stuff like that. Yeah. We have a lot to talk about that, right?
And I agree. Again, any of the things that we're talking about, any of the screening tools, or just some of the things you could look out for, can be useful when your kid is playing, because in the end, when they're playing, they're still moving, they're still doing some athletic work, if you will.
Yeah.
And this is not to say either that if you find some things in your kid that you may be concerned about, to say, oh, well, then my kid shouldn't do athletics or shouldn't do sports. That's not what we're saying. We just want to make sure that everybody knows what to look for so they can be safe.
True.
Maybe seek more help.
And overall prevent injury.
And prevent injury.
Yeah.
I think that's more important. And longevity on whatever they want to do. At the end of the day, we want to be able to, I have a couple of examples in my own personal life with my own child who was playing basketball. We didn't know that she had a precondition to the knee, and it wasn't until she was already playing basketball. And here I am, I'm a therapist, right? But we knew she had cricks and cracks on the knees, but it wasn't until she actually started playing basketball that it became a problem. And to a point where we had to get an x-ray, we had to get through the whole process. Mind you, if I was more attentive to this, maybe I would have caught it earlier, Yeah.
And actually, I saw this statistic that said 3.5 million injuries in the United States in kids from playing, sports-related injuries.
Keeps our jobs going.
Right.
Job security for therapists, but no, come on, you need to be able to see it, and maybe if you don't feel that you're qualified to do some of these things that we're going to share, maybe get somebody who is, right?
So we believe that the best way to prevent those 3.5 million injuries would be to have a better screening technique, right? Where a lot of the times these young athletes are just going into the sports, and maybe they're registering online and just checking off that everything's okay, but no one really investigated and cleared off that's more professional, whether it be a pediatrician or a physical therapist, right? Mm-hmm. So definitely getting that pre-screen is kind of where we want to talk about first. And ladies, how do you think we could start that? Where would a parent why would they even pre-screen, or how would they even do that, right? What do you guys think?
I think we can just start by thinking about, again, not ignoring those little, like, everything's fine, but if you do have a history in your family history of conditions, or your child has something, again, it's not to say that they can't do a basic sport where they're not going to be the mega athlete, but I put them in this little team and stuff. Mm-hmm. But don't ignore the fact that your child, or in your family history, there's history of asthma, there's history of heart conditions. And maybe just look a little deeper into that, or think about how that may affect your child, or ask your doctors, ask your peds, like, hey, they're about to start whatever, soccer. Yeah.
Okay, hell, you're gonna be doing soccer. That wasn't planned. It was not rehearsed.
That's where ours started.
That is so funny. Jiu-jitsu. That's how my people started. Jiu-jitsu. Actually, there's a lot for us to talk about that. But I do want to say this too, and it just popped in my head. Maybe some of the parents and caregivers are saying, might think, okay, I'm going to put my kid in a room, in a sport, be it gymnastics, soccer, right, whatever. The coach should know if they're ready or not. And that's the thing. Like, again, love the coaches. We appreciate a lot of coaches. We have been coaches. It's not about that. It's about maybe they lack the information to do those screenings themselves.
Right, absolutely.
Okay.
Well, a lot of the times in these leagues, at least in rec, right, these coaches are volunteers and they're just the father of a child that's there.
If you look out and get a PT for
that would be really great.
But knowing our lifestyles, we're probably not the ones volunteering.
Well, I have actually coached a soccer.
Oh, okay.
But again, one time. Right? So it's not always, because we don't always have time, and all the volunteers, you don't know their background, which again, wonderful that they're helping, but they're just there to be like, what type of drills and stuff.
Right.
And even in those little activities, things could cause injury, could be
100%. And I wanted to add, before we jump into the media ingredient, I would say this. We tend to also, and I think just generally, we either are too much given to our kids, like, oh, this hurts. Oh, okay, let's go to the hospital and get an x-ray. Or this is starting to hurt. No, it'll be okay. It'll be okay. And that's where we also want to bring it in. Maybe your child started out well. Maybe, based on their positions on the phone and in the computer, that added to some of the injuries. And then now they're actually developing other structural problems or maybe biomechanical problems. Right. And we tend to be like, nah, it's okay. You'll get through it, and that you'll get through it could eventually lead to something a little bit more serious, And
another thing is in the history that I think it's important is if your child was already diagnosed with a developmental delay, or maybe they weren't diagnosed, but they've always been a little bit on the slower milestones, right, that are the norms, then I think that we should take that moment and really consider a deeper screen by a professional, because if they've been delayed and that's been their trajectory, it's not like we're going to wake up one day and all of a sudden they're going to catch up, right? A lot of the times there's an underlying reason. It may not be something serious. It could be a little bit of a postural alignment thing or a tone thing or a little bit of a strengthening thing. So those specifications will be given to you by an actual therapist who really could assess the mobility, the movement patterns of that specific child. Because a lot of the time some of these sports are asking them to do certain movements that are very high level for the age they're in, which is another thing to consider as well. Like your child can't do like 5 steps to a drill. Maybe it's because developmentally they're not
ready
there.
For that. Yeah, that's such a good point, Doc. And I do want to say I have worked in the past with schools, high schools, and football games, and pre-screening the athletes that are going to try for pro, picks or whatever. So I, as a therapist, have had that experience in assessing some of these kids and had a bunch of kids. So it's not to say that there's no screening. As a matter of fact, I think that's a good leeway to what we're going to talk next, which is what is out there for screening, first of all. But I think that we're also trying to make a point is not just think of the kids in high school, but the kids earlier on. Yeah. Right? Because yes, maybe at the high school level, they're starting to implement some of these screenings. We're talking about the 3, the 4, the 5-year-old who wants to join gymnastics, and you don't know if their cervical spine, I have a couple of visual aids today. If their cervical spine is stable enough, and then you put them on their heads, and then you have a dislocation of the actual cervical spine, right, where maybe could have been caught on by someone. And because it's not such a normal thing to do, that's what we're trying to focus on.
I would say start with, again, the basics, knowing your child's health history. And if you don't know, because sometimes we go to the doctors, and if maybe you don't have a background, it's just like, okay, everything looks good, and maybe we don't ask enough questions and stuff. So start there. And then secondly, once the child starts in the sports, maybe just keep track of the things that they're saying, right? Like if they're saying something's constantly hurting, sometimes we can figure out that it's just because they were dehydrated
or they are trying to get out of doing something.
But keep track so that if you don't know specifically, you can say, well, this day they said this and they said it again this time, and then you can ask somebody that can maybe help you figure out, was it just dehydration or was it an actual issue, or are they dizzy because of a brain thing or a heart thing, or
see patterns as well, right? So maybe you don't want to go the first day. Maybe the first day they had a little dehydration, but then you start to notice that every time they come back from practice, they started having trouble with some types of things. Take notes, like Doc is saying, we are, or even Vero said, we are kind of busy, we don't know what to ask, or maybe we have all these ideas to ask at a doctor's appointment, but then we forget because we didn't write it down. Okay, so check for a pattern, check for, oh, is this happening every time you're coming back from practice, or not? Could it be just throwing something out there like an exercise-induced asthma type of thing, which you really just see it minutes or a couple of hours after you finished exercising. So that means the coach wouldn't have seen it. Maybe the students, the friends, but the parents, once they're home resting, and then maybe not connect. Every time I'm here and they're looking for different things, so that's where we're trying to kind of open your guys' eyes to some of these things. So where are we going?
The screening tool.
Well, there is a pre-participation evaluation that is recommended by orthopedic surgeons and orthopedic professionals, and also the American Medical Association and all this stuff. And one of the parts of that is what they call the Physical Activity Readiness Questionnaire, right? Or known as PARQ or PARQ. Okay. But what I like about it is that it's a good start. It is a self-assessment. So it is recommended for older. Again, everything's kind of targeted to college and high school, unfortunately. Right. Yeah. But as a parent, you can also consider these questions.
Right. Maybe modify a little bit.
Right. It has, again, things like, do you have a heart condition that you know about, stuff like that. But then it says, like, do you feel pain in your chest when you're doing the physical activity? Do you lose your balance? Do you get dizzy? Right? Do you feel that you constantly have a joint issue or some pain or something that's happening when you're moving? Right? So those questions could be helpful. Maybe the other ones could be a little advanced, but those could be questions that you can consider when you're thinking about, should I seek out more help? Right. Should I ask more questions?
Or even what patterns to look for, right? For some of the things, because if you're not in our field, then maybe a chest pain wouldn't have mattered as much because you're thinking it's a child. And again, just with the example I used earlier in this episode, it was a pretty sad thing that this child had passed away in elementary school because he had a heart condition that nobody had known. And it wasn't caught at their, early when they're born. And they do their screenings.
And typically they don't do, like the advanced heart screenings or the EKGs and stuff.
Don't look for murmurs.
All the time, because again, doctors don't want to over-diagnose people either and cause like false positives and misdiagnoses. But at least they're starting to move in the direction here in Florida where they're trying to make sure that athletes, at least, that are doing heavy heart work are getting screened. So there is a new law that's in effect in July of this year, or it's going to come into effect, to make sure that athletes do get EKGs, just to make sure that we rule all of that out. So that's a good, stepping area, stepping in the right direction. But again,
just high school.
Yeah,
it's not for those that are starting. So if you're thinking about your 3 and 4-year-old who is about to start, where I would start for screening after we review medical history and anything in their birthing history that maybe would be a red flag. The second part would be posture. I think our posture tells us a whole story of what's going on with the muscles and, of course, our movement and how we move, right? Yeah. So a lot of people think that maybe once the kid starts walking, you have normal feet alignment with our arches, and that's not actually necessarily true. Kids don't really start developing normal arches between like 3 and 4 years of age. So by 5 and 6, those arches should be there. And a lot of people do suffer from what's called flat foot or overpronation. So I would actually start and screen the foot and make sure that when they're standing straight, their feet don't look like they're all in and flat.
So
like
I'm going to try to do it here. So a pronated foot looks really odd with that flat.
Put it on the side so you can see the arch is supposed to be there.
Right.
But then it would be kind of
and it flattens out, right? And it almost looks like they're flaring up the side of the foot, the pinky toe. They may not be flaring it up, but it almost looks like because they're sort of like leaning. And then you will see, we can go further, but you'll see that it affects the knee and then it affects the hip and then it goes all the way to the knee.
And this is a good screen for any age after, after 3 or 4 years old, like, to be honest with you, because a lot of adults I've seen walking around and I'm like, oh, they have really flat feet and there's doesn't seem to be any inserts or any specialized shoe that they're wearing. So that's something that I would start with, because that lack of arch actually trickles up to the knee and even the hip. And what happens is when they're doing their jumping or their squatting activities, it's going to mess around with their alignment. It could also cause a disequilibrium, meaning that their balance could get lost with those activities that require a little bit more balance, like a single leg stance. So that means anytime they're standing on their one foot. And a lot of these sports do drills and require that, or those cutting motions and things like that, and they don't have that ability to really, that muscular support there. So that's where I would start, at least.
So I think that can lead into, before we maybe talk about this, looking at when your child is moving, jumping, squatting, single leg standing. What are those legs doing? What is that knee doing? Is it like veering off side to side, turning in, or are they steady and still? Is everything kind of stacked on top of each other? Because that will already tell you that maybe they have instability. I think with children, what happens is that we're like, well, they're children. They're going to grow out of it. And they're gonna have better. Obviously, they're weak, and obviously they're imbalanced, and obviously they're discoordinated. They're children. And again, yes and no. Exactly. So it's where physical therapists sometimes come in and can help really tell you what ages it's normal or not normal. So you can definitely seek out your specialist for that. But they shouldn't be just fully all over the place, just coordinated and all of that.
And I want to add to that is that, okay, so maybe for the time being, they're learning the skill, right? And they're this, and so you're giving them a chance to say, okay, they're all over the place, but they're going to get, okay. But if we don't address some of these issues, which if you have a coach dealing with 20 kids, okay, are they going to individualize that program for the kid? No, they're not. What will happen is your child will develop compensatory motions. And those compensatory movements will continue with them as they grow, as they do whatever they need to do. And so now we're going from, it's just growing pains to, oh, I have a meniscus tear or I have, this. So these are the things that, and then the other thing I want to add is the jump from one expectation to the other. So much like what you guys are saying, there's jumping, there's squatting, there's cutting, there's all of that. But we as therapists, we know something we call mobility before stability, we have a guess, before controlled mobility, before skill. So I think that all of our viewers that understand this will say that the jumping, the squatting, the cutting, that's a skill.
Yeah.
Right, 100%. Doc? I mean, she's the doc. That's the skill.
That's the definition of motor control. So if we want these kids to look like they're coordinated and have this motor control.
So how are we going from them being mobile, because they're heck mobile, that for sure.
Yeah.
How are we going from them being mobile to doing the skill by jumping? Like there's a gap.
Yeah. 100%. Yeah.
Okay, and that's what we're trying to say.
Right. And then that's where no parent's gonna know, like, what do I do with that information, right? That's why it's very important to find a professional to be able to actually dig a little deeper. And honestly, it prevents a lot of future injuries, because that whole pronation thing could lead to something that's at the knees. That's called valgum. You guys maybe know it as knock-kneed. And so there's a higher chance of ACL tears. And there's a lot of athletes out there, even if they make it to being professional, that have had an ACL tear.
So absolutely. We naturally have a little valgum. It's called the 15 degree Q angle. So we're not like Barbies and we don't stand straight like this. There's a tiny little, natural curvature, sort of about 15 degrees. So it's really small. Okay. But what Doc's saying is the minute that this is super flat and then it starts throwing the tibia this way, the body's going to compensate and throw the femur back this way. And then all of a sudden you have this, what it looks like knocked knee.
Right.
And that can cause so many issues. As you can see here on the model, it can tear ligament. Okay. It can change your patella alignment. Just like that, guys. Pretty incredible. And then it can mess up that lateral meniscus as well. In other words, we can go on forever on here, but.
And it's actually a good screening test, having them jump from a higher level to a lower level, having them squat, and looking at those mechanics, because it is maybe not the most efficient golden standard indicator that they're gonna have an ACL injury, but is a good start as a screening tool that if they're landing in that way and the knee is going in, that they could possibly
so there's a couple of jumps that as a physical therapist I'm gonna look at in a child. So the first one is actually in place. How high do they jump off the ground? How does that look like, right? Then we have jumping forward. So not just how far they jump. I actually don't care. Right. I actually don't care how far they jump. I care more about the quality of the jump. So that squatting right before the jump, what we call the takeoff, right? And then into the landing. I look at both aspects of the jump because sometimes they have a good takeoff, right? But then that landing, those knees go in or the feet go out. There's no graded control. So we look at that. And like you were saying, the jumping down an object, a box or a step, and how do they jump up onto something? Because all those mechanics are going to actually tell us, the therapist, the whole story about what's going on.
What's about to come. Possibly. Right? Absolutely. Nobody sees the future. Not even the DPTs were able to give you more of a prognosis, meaning, hey, in so many weeks you might be able to go back and this and that. But the truth is that it is most likely due to the pattern and due to the compensatory movements that they will develop those later
on. Malformation, or if you will, like a lack of strength, or maybe it's range of motion, I would have to dig in deeper, would be if they like land with one foot slightly ahead of the other. Okay, so it's not just
asymmetry.
The asymmetry. So anytime that the right and the left side of the body are not, they're too far off, because everyone has a little stronger side, which, by the way, it doesn't start till after 5 that they really hone that in, that dominant side. Before that, things should be almost
pretty
even. So if they see any asymmetries or differences with the right versus the left side of the body, like they're always leading with the right or always leading with the left, or when they're going downstairs, they're only putting the one foot as they go down. Those are little signs that something is off, whether it's coordination or strength or some sort of something in the muscle control, like you were saying, that mobility, that stability, or
it's like we're jumping steps, expecting them to be able to do. And then unfortunately, like we said, some coaches that might be on the high school level and stuff, maybe they have more experience than being volunteers.
Right.
But the truth is that sometimes we can't even blame them because they just don't know. They're not trained for that.
Correct.
And it's not until it's too late. I saw a story. I don't know if it's too early for that, but I saw a story that really broke my heart. And it was one of the social medias. It was a young child, like a 5 or 6 year old young child who always wanted to join gymnastics, and they did, much like any other kid who was at that age. But she had an instability on the spine that wasn't caught on, and she actually became paralyzed. Wow. She had a spinal cord injury at 5 years old for doing something super simple. It wasn't even like a back bend or anything. It was something like a tumble, a roll. I sent it to you guys, but it was just really heartbreaking because we sit here and we're like, if they had just checked for her trunk stability, give her a plank.
Right.
Right?
Exactly.
See
and
how
also,
well
like,
they can
the hypermobility. So hypermobility means too much motion, right? There's always a good medium that our body needs. We need to be right in that happy place. And too much mobility is called hypermobility. And there are other screens, right, Vero, about that, like something simple.
So there's this test called Baton-Horn criteria, or test for hypermobility. And they literally just start with like the hands and the fingers, right?
Like this? See, I wouldn't pass the test.
Oh, you failed.
I don't have it. I don't have
And
it
so
until you push it back.
Like how far your pinky goes. Can your thumb like touch the forearm and stuff like that? Okay. And again, kids are a little more flexible, but it doesn't mean they have like the more of these that they're extra flexible on, the higher the score, the higher the risk that we're saying, that hey, you're a little extra mobile. You know, looking at the hyperextension of the elbow. Okay, so she has a little bit more than us, but again, not everybody should. I don't think. I think mine is pretty straight. So things like that. But we as therapy professionals can check all the joints and really make sure. But even just little things, if you're noticing that your kid is extra bendy, extra flexible, again, not to say that that's something that we can't work on. We can work on
or the one that's super common for kids when they stand. So they stand and their knees are like backwards like this. Yeah. General recurvarum, we call it, but a hyperextended knee. And it's funny, like I saw also another video, this little kid, she's fine, and then all of a sudden she rests and she goes and she pushes it straight back. And then the mom says, stand straight. And she's like, whoop, and she brings it right back. So for me, her having that control is really odd. But at the same time, it's what you're saying, the hypermobility, if they land on that knee and they don't have the right controlled mobility, right? Then they're going to hyperextend. And if they go beyond your norm, right? Your norm for extension is 0. She's going here, right? That's already going to be prone to injury. It's already stretched out.
They need a little bit more stability work and to really strengthen all that.
Absolutely.
I'm going to bring us up to the scapula and our shoulders because we've been focusing a lot of what's going on the lower extremity. But what about our pitchers or anyone that's doing things that are overhead? At this point, that's very important. And there's something called scapular winging, which basically is your shoulder blades kind of stick out, and I see that a lot as well out there, where it's telling me as a clinician that there's a little bit of instability. And a lot of people think that the shoulder is just the shoulder joint, but we move with that scapula moving as well. And if it's not strong, the whole girdle won't be stable, which again is going to make them prone to injury, especially with those overhead type of sports.
And let's be honest, regardless of whichever sport it is, and even throwing in a little Brazilian jiu-jitsu here, because I think there's a lot of grapplers out there and people who like to be on the ground. When you do something too much, it becomes a problem, even if you don't have any pre-screening issues. But at some point, if you're going overhead and so that's where preventive work comes in as well. So if you didn't catch it on screening, but you start to notice that it's developing, do it as fast as you can to, and then look for what you're looking for, try to see what you're looking for to address it fast and not turn into a problem. Because what you're describing overhead for, pitchers, for basketball players, for fighters, they get a lot of injuries on the scapular area, on the shoulder area. And a lot of kids are starting these things now, even fighting, MMA fighting, there's jiu-jitsu fighting, and it takes your joints to extreme positions. And then here we are probably looking at a bigger
And I'll go to the other end of that. We've been talking about more flexibility. But sometimes there's lack of range of motion, especially at the ankle. I mean, my kids are toe walkers, so they have an imbalance with the dorsiflexion range and stuff. And that could lead to, like, again, if you're landing and then cutting and the way your foot is, like, you need that flexibility of the ankle. So sometimes even lack of range of motion could be something that we look at.
Right.
Absolutely.
So there's a few things that if you want to screen your child to know if they are ready for sports, the first thing is know their history, right? If you already know that they've been on the little delayed side, you definitely want to get an extra screen with a professional. I would say the second part would be looking at their mobility. Do they have extra mobility? Are they very flexible, more flexible than normal? Or are they lacking, like they're always so tight and they can't reach and they can't bend, right? And then I would look at their posture, right? We were saying, do they look like they're straight, or is there things that are a little bit out of the alignment? Are their toes out? Are their toes in?
I know, everybody's talking like,
Are they a little bit kyphotic?
Are they looking up and kyphotic?
Right? Are they on those screens? Okay. Is the whole body, is it symmetrical? Does it look even, or is like one shoulder up here and the other one's down here? Those questions about posture. Then, like you were talking about planks and just strength. Are they a strong kid? Are they able to help you get the groceries, and pick up things? And do they look weak? Are they always tired and fatigued? Can they?
Or they even use compensatory movement for a squat, because you ask them to hold something, grab something heavy, and they might, but they're using all this wrong, right? And then you're like, okay, well, definitely. The trunk stability is a big one too, because everything starts at the core. I mean, you can do a whole episode on that.
Right.
But, we probably will. But that is a big one, man. If they can't initiate the movement through here, then all the other stuff is going to suffer.
And then there's balance. Does your child, can they balance? Do they walk a balance beam or a makeshift one, like the parking stumps? Do they walk one foot in front of the other? Can they hold their balance with their eyes closed, or do they like wobble all over the place? And then
that's a good point. Are they walking like this when you're playing with them, like, any type of game, and then as soon as they close their eyes, they start taking a turn? Like, right.
And then the overall thing is their movement patterns. Do they tiptoe walk? Do they run funny? How's their run? Is it uncoordinated? I always remember like Phoebe from Friends.
Oh, I was about to say running like this.
Like, how is their run? Because there's a specific pattern for running that we're supposed to have. So how do they look when they're doing higher level intense gross motor things? If they look awkward and you think your kid looks awkward, sorry to tell you, it probably is.
You're probably right.
You're probably right, because no one knows their kid like their mom.
That's
right?
That's our family, point right here.
So just if you're like, oh my gosh, yes, my kid has a problem with that. My kid has a problem with that. Yep. Then you fall into, let's get your kids screened. We're definitely not saying not to put them in an organized sport. We absolutely love that. We love martial arts. We love all of it.
We're all for that.
But we want our children to be safe and not get injured.
And not quit.
And I'll,
I guess, kind of summarize some of the key points. This is not, again, to say that you're trying to make your kid be a pro athlete and stuff. And even if your kid is just doing it for fun, it's really more about making sure that their fun doesn't end because of an injury, or that it doesn't lead to things in the future.
Right.
Sometimes people don't seek out specialists or do these type of things because they're just like, oh, they're just running around so I can get them to run around or whatever. But we, like with any risk factor of anything, right? If the doctor tells you your kids need to eat healthy and drink water, it's because you're preventing things in the future. You're creating a pattern. So we don't want to forget that in the physical aspect.
And the movement.
Even if they're just playing, even if they're not going to be a pro athlete, again, it may not be things you notice until they get to running around, until they get to the point. So it's just something to know and something that you can consider. And maybe if you want to find out more information about it, you can always go to your resources. We can maybe be some of your resources. It's like, oh, well, my kid is a little weak in the knees. Is there anything I can do about that? And we can figure out how to.
That's a great point. We'll get you guys interacting with us. There's the comment section. You guys please share all of this stuff, because if we can't help you because of being far or whatever it is, we can certainly help you search for someone who can help. And there's so many. And if you're a coach, if you are a volunteer dad, okay, or mom, hey, look us up. Look other different types of trainings that you can get. Right? Absolutely. Because if you're going to, I don't get to do those as much. I'm not going to be a hypocrite and say I do or lie. But if I did, and I volunteered a lot, then I'm that type of person. So I'm volunteering for basketball, then I need to know all about basketball and all that can happen with basketball. And can I get certified in basketball? Like, how does that work? You know what I mean? So that's definitely something that, don't feel like, oh my God, I'm doing this wrong. Yeah, but today is the end of the day, is the end of the day. Tomorrow's another day. So you can get yourself certified. You can get your kid, screened. And we're here if you guys need us. So,
all right, guys. Thank you so much for joining us today, and hopefully you learned a little something. And keep your kids in sports. That's
because
movement matters.